Independent Senator Bernie Sanders is now joining calls for RFK Jr. to resign. Senate Minority Leader Chuck Schumer is asking President Trump to fire the Health and Human Services Secretary after the administration fired CDC Director Susan Menarez. The New York Democrat releasing a statement saying that the president made a mistake hiring RFK Jr. and must fire him immediately. Schumer went on to call RFK Jr. stubborn and pig-headed, and that, quote, conspiracy-based attacks on proven science are going to make many more people sick and cause more death. Well, Menarez went head-to-head with the HHS secretary over the decision to remove approval of COVID-19 vaccinations. Her ousting led to several high-profile officials leaving the department, and the Senate confirmed Menarez in vote along party lines, becoming the CDC director just back in July. We're going to welcome to the show now vascular surgeon Dr. Anahita Dua. Great to have you here. Thank you.
Thank you.
So look, we've got Schumer calling for RFK Jr. to be fired, and RFK has been at odds with the CDC, the FDA, the Vaccine Advisory Panel, and the NIH. But RFK says he's here, he's just rooting out conflicts of interest. He says he's draining the swamp of influence from big food and big pharma. Is he?
Unfortunately, I don't think so, but I do believe that he thinks that he is, and I think that's where the conflict is arising. I do believe that he wants the best, but what he doesn't know, he doesn't know. And in science, unfortunately, this is one area where you just cannot be political. You can have dissenting opinions, and you're supposed to do that to move science forward because science is a living, breathing thing. So it's important to have people like RFK at the table and people like Menarez at the table so that the discussion can be led by both, and then ultimately the data and the science always wins.
Do you think excuse me, sorry.
Please.
Do you think that big food and big pharma has had a stranglehold on any of these government agencies related to Americans' health?
Of course, as with every other agency. In fact, we're seeing it right now, with the MAHA movement, for example. They're big on not having pesticides, for example. But the agricultural side of things, Trump is, of course, supporting, saying pesticides, actually, they're bringing back ones that were banned and saying that we want to take care of our farmers and we want to, push this forward for that group. So there's going to be conflict there always. And ultimately, we know that with campaign finance law and the way that we run our country with Congress and the Senate, all Americans are aware that money guides a lot of things. But you can't just say everything is run by that. Dr. Menarez, for example, is a PhD in microbiology, very intelligent, and an academic. And believe me, academics are not people that get really swayed with money. Otherwise, we wouldn't be in academia in the first place.
Well, let's switch gears to this, because RFK and Education Secretary Linda McMahon, they're demanding health education reform. Is this a good idea? Is this necessary?
Yes. I think this is a good idea. This is one of those things where it does make a lot of sense. Nutrition, of course, feeds into, no pun intended, how people end up doing in terms of chronic disease and preventative disease. However, when I read what they plan to do, it's basically what ChatGPT would tell you. What I mean by that is if you want to do this, you have to do it right. You have to sit down and say, what do you mean by nutrition? What do you mean by I want to teach this curriculum? What is the curriculum? Right now, we already teach nutrition. There's actually a whole section in the NIH focused on food and how nutrition affects the health of people, and that's been around for 25 years. But if they're saying that there's a problem, they have to tell us what the problem is, and they have to tell us what specifically they have an issue with and what they want to teach, so that we can tell them as the academics, oh yes, this is appropriate or this is not appropriate. Also, there is no food that is going to cure cancer. You have to do everything in tandem. And we can't forget all the people that have chronic disease because of genetic issues and just say, oh, if you eat more fruit and vegetables, you won't have these horrible things.
Right, but as a doctor, you do know that we would lower our risks of developing some forms of cancers if we do eat more fruits and vegetables and we stay away from the ultra-processed foods, correct? Or
absolutely.
Do you disagree?
No, absolutely. Yeah. No. I completely agree. The question is, which cancers? How much? How much does your genetic makeup play into? And that's where we need the NIH to keep, evaluating this. There are people that have never smoked a cigarette in their life that get horrible lung cancer. And there are people we both know that have smoked packs a day and nothing happens to them. And the same thing is with nutrition. So I totally agree with the education. But what I think the mistake is that RFK is trying to push too many things at the same time. This takes time. It's okay to say we're going to figure out the autism thing and, work on it a bit more than we already have. But you don't have to do it by September. Take your time. Do it right. And I think that's the mistake here, that too many things are being pushed and so many things are breaking, and we can't afford those broken institutions. We can't just not have a CDC.
Right.
That's going to hurt us a lot.
Yeah, RFK has said that, an ounce of prevention is worth a pound of cure, and perhaps doctors should be educated more from a nutrition standpoint to prevent some of these diseases that Americans are grappling with in numbers that we didn't even a couple of decades ago. Really appreciate you being here. A vascular surgeon and the founder of the Healthcare for Action PAC, Dr. Anahita Dua. Appreciate you being here.
Thank you very much for having me.
All right, friends, listen to this. I have some exciting news to share. I'm starting a new podcast. It's called Working It Out with Anna Koyman. Hey, that's me. Each week, I'm going to be talking with different health experts